So in this video, I'm going to be telling you how to become a medical consultant in Nigeria. Now, this video is so important for aspiring medical students who want to become doctors in Nigeria. And what I mean important is really, really, really important. So I want you to take out your pens, your jotters, and listen to what I have to say. Hi, if you see my face for the first time, my name is Dr. Grace Essien, and I am a doctor and a YouTuber working in Nigeria, Rivers State. So the decision to be a medical doctor starts from secondary school. The moment you're moving from JS3 to SS1, you have to decide and say, okay, I want to be a doctor. And because I want to be a doctor, I have to be a science student. So you're going to be a science student from SS1 to SS3, where you'll be taught biology, chemistry, physics, mathematics, English, and any other subjects. But these are the 5 most important subjects that you'll be taught in science in order to make you a doctor. So once you're done from SS1, SS2, and SS3, you are going to write your senior WAEC. You're going to write JAM. Now, in your senior WAEC, you need at least the minimum of C, that's a credit score, to be able to go into the university. So you need a minimum of credit score in mathematics, English, physics, biology, and chemistry. At least these 5 subjects should have a minimum score of C. Any other thing can be worse than that, but these 5 need to be a minimum of C. You also have to write the JAM exam. That's Joint Admission Matriculation Board exam. And in that exam, it's scored over 400. So you have to try your best to aim for the highest score possible. Now, I'm talking about score of 280 and above, especially if you might want to be in a federal university where you need your JAM score to be extremely high, because in federal university, the competition is higher than in private university. In federal university, there are plenty people looking for the position, plenty people wanting to go for that spot. So you need to work hard so that you can be picked. Like, just try and work hard. When you're registering for JAM exam, you have like the list of universities that you get to pick from. You put your first choice, your second choice, and your third choice. Make sure that the university you want to enter is actually put in as your first choice. So once you apply into university, most universities, they have their own exams that they call post-UTME exams. That's you're writing a JAM exam, you're writing your WAEC, and then you want to like do your medical journey in that particular university, you most likely will have to write an exam that the school will conduct. Like I said before, make sure you aim as high as possible in that examination. So my advice for you is to look for all students that were in that school, or if possible a year 1 student that just wrote the exam recently, so they can tell you the nature of that particular school's exam and what you should expect, what you should read. Because the truth of the matter is that private universities, they don't have past questions for UTME, but most federal and state universities, they have past questions where you can go through and know the kind of question that you should be expecting. Congratulations, you have entered university. So what are you expecting in university? First thing you need to know is that medical school is a journey of 6 years minimum in Nigeria. Now, why I said minimum is because ideally medicine is actually 6 years, medicine and surgery is 6 years. But because of the country we live in, Nigeria, there are different factors that can elongate your stay in university, especially if you're a federal school. That doesn't mean that your stay in private school cannot be elongated, but the chances are very small, and I'll give you reasons how a private university stay can be elongated. But let's start with why your stay can be more than 6 years in a federal university. The most common is if you fail an exam. So in medical school, you must pass your exams. So if you fail, you write a receipt, and you still fail the receipt, you have to repeat the year. And yes, you heard me. You have to repeat the year and pay another school fees for that year. So this is basically the most common thing that can make a student stay longer than 6 years in school. That's for federal. And another thing again, federal factors, government factors, Nigerian factor. May Nigeria not happen to you? Strike. A body can go on strike. ASU strike, NASU strike, all these strikes, people go on strike, and if there's strike, just forget about it. A month can be gone, 2 months, it can even reach 1 year. So yeah, strike is mostly what affects federal universities, mostly what affects students in federal universities. They don't allow them to go and graduate on time. Strikes and failure. Now for private universities, failing is also one thing that can make a student stay in school. School fees, increments in school fees. If school fees is increased and you did not budget for that for the year, it's possible for you to not be able to pay and you might drop out. It's mostly failing, school fees. And then private, maybe if there's also a pandemic like COVID-19 that happened. COVID-19 happened in my year 2 crossing over to, in my year 3 crossing over to my year 4. I remember we could not write our MB exams. So those are the factors that can make one stay long in school. Payments of school fees, if there's any delay or there's no money. Failing the year can make one repeat the year. Suspension, maybe anything that you were caught, maybe cultism, drug trafficking, or you were suspended for 1 or 2 things, it can make you repeat the year in both federal and private setting. Then strikes, any pandemic, those are the factors that can make you stay longer than the expected 6 years that is required for a medical student. Now, even though you're staying in school for 6 years, every year you write exams that will make you move from one stage to other. So that's what we call the MBBS exams. Some places call it part 2, part 3, but you shall write MBBS exams. The professional exam you must write to qualify for the next year. Now, while being 6 years in medical school, year 1 is always a general class for everybody. You do general courses. Then year 2 is when the whole movement starts. So your year 2, you do anatomy, physiology, biochemistry. Now, anatomy is broken down into embryology, histology, gross anatomy, and then you start dealing with cadavers in the lab where you dissect human beings to see. It's more like your taught theory and you're doing the practical life. So year 2 and year 3 basically is this anatomy, physiology, and biochemistry. Then you write your first MB exams that will now make you move to year 4. Year 4 is your pharmacology and pathology. And yet again, pathology has 4 branches. There's the hematology, chemical pathology, which we normally call chempath, anat pathology, or sometimes we call it gross pathology. And the first one is microbiology. So these 4 courses make up pathology. So just a minor advice, an unsolicited advice. If you are to fail anything in year 4, please fail pharmacology. Don't fail pathology, because if you fail pathology, you have to resit the 4 courses in pathology. So if you just have to fail, maybe your strength cannot carry for the 5 courses, please fail pathology. Please fail pharmacology, because pharmacology is just a course. You can use 3 months to read again and get yourself back. But you see pathology, on the other hand, 4 different courses. You're going to do Viva for the 4 of them. Viva is the oral examination. You have to do OSCE for the 4 of them again. OSCE is when you are timed 5 minutes for a station to answer the question that is on that station. So imagine doing an essay, that's the theory, objective, oral exams, OSCE for 4 good times just because you failed pathology. So please don't fail pathology. It's better you just fail pharmacology. In fact, the best, don't fail at all. So after I write those exams, the next is your year 5. You move to year 5. Now in year 5, you are being taught pediatrics, obstetrics, and gynecology. Obstetrics and gynecology is together, female reproductive health, and then pediatrics about children. You're dealing with from first day of life to 18 years old. Yeah, so that's what happens in pediatrics. That's what happens in year 5. So you have to write another exam that will qualify for year 6. In year 4 and year 5, you're still going to do medicine and surgery, but in little bits. But you're not going to write any MB exam for medicine and surgery in year 4 and year 5. But you're going to be taught and you have to do like tests. Then in year 6 is the main thing, when you have to do your medicine and surgery. So in year 4 and 5, you also do community medicine, but a little. But you see, year 6, you do the main internal medicine, surgery, and community medicine. So everything you learned in year 4 and 5 concerning medicine, surgery, and community medicine, we bring them back to year 6, and then you finalize it, you talk about it in deeper terms and greater numbers. So you write the exams in community medicine, internal medicine, and surgery, then you pass. You're done with university. So once you're done with university, the next step is house job. House job is a very, very compulsory thing. Like, it's so compulsory because that is actually where you tend to understand and get clinical skills. That is where you learn how to sight lines, that's putting of an IV, intravenous cannula. That is where you learn your basic skills, clerking. You think you learned how to clerk in university, but trust me, house job, you will clear because the patient will see you first before your senior. So you assess your patients, you pick up basic clinical skills, and it's a compulsory 1-year program. Housemanship in some countries is called internship program. In US is an internship program. In UK it is called foundation year 1 and foundation year 2. But in Nigeria it is called housemanship. So it's a compulsory 1-year training. You rotate through internal medicine, surgery, obstetrics and gynecology, and pediatrics. So that's 4 in the hospital. Once you're done with your house job, because house job is 1 year, you go for NYSC training. Now, NYSC training is a compulsory 1-year training that every graduate in Nigeria must undergo immediately after school. Well, not immediately, but at least before you're the age of 30 years after uni. So you have to go for that 1-year program because you're basically serving the country. You're giving to your country. So do that for 1 good year. Now, remember, you don't have to write any qualifying exam to do house job. You don't have to write any qualifying exam to do NYSC. But if you just want to be a medical officer, you don't want to graduate and specialize, you can stop at NYSC. You can just work as a doctor, a medical officer. But if you want to graduate, you want to specialize, which I'm trying to talk to you about, you have to write another exam called primaries. Now, this primary exam is a qualifying exam. It has a total of 200 objective questions, computer-based exams that is taken in either Abuja, Enugu, or Lagos, where you have to write this exam and then you qualify to become a registrar. Now, this is where residency starts. This is a journey through specialization of being a consultant. How long the residency program will be will depend on the particular specialty you want to specialize in. If it's surgery, of course, it's going to be longer. Anesthesiology is, I think, 4 to 5 years. Pediatrics is not so long. Shockingly, I'm quite shocked that pediatrics is not long. But anyway, you shall have to write the primary exam to become a registrar. You write another exam that we call the Part 1 exam. Now, this Part 1 exam is also taken in either Enugu, Abuja, or Lagos, or even in Ibadan. I think it's also taken in Ibadan. Yes. So this Part 1 exam is written by a registrar, and then the person will now pass and be a senior registrar. So you have 2 to 3 years of being a senior registrar. You now write the Part 2 exams, then become a fellow. After being a fellow, what else? What else you want to do? You can well aspire to be a professor. You might want to be a lecturer, so you can be teaching in a teaching hospital, and you can be teaching in a school that has a teaching hospital, and then you can be teaching students. You teach juniors, you teach your registrars, the residents, you teach people. You can teach online, you can go for conferences, you do a lot, you publish papers. So it all depends on what you do. Most people stop as being a consultant and they don't want to go further. Some people, they go further as long as they can continue. Some people will become examiners. They go for professional exams and examine them. They examine other resident doctors, maybe in their Part 1 and Part 2 exams. Some people even become lecturers in universities and they examine students. So yeah, it all depends on what you want to do after becoming a consultant. So I hope this video was helpful for anyone that wanted to find out the journey and the pathway of becoming a medical consultant in Nigeria. I'm going to give you more updates and more videos in the medical field, journey through medicine, and stay tuned for more videos. Please don't forget to subscribe, I beg of you. subscribe to my channel, please. Share. You can also share my videos to your group. If you are a doctor or an aspiring doctor, a medical student, a house officer, you can share these videos to people in your groups, your group chats on WhatsApp or Telegram. You can also share with your friends so that they can understand the journey that they're going to go through. I'll see you in my next video. Bye for now.